Question 1. What is the generic name for the brand name medication Lipitor? A. Simvastatin. B. Atorvastatin. C. Rosuvastatin. D. Pravastatin. Answer B. Atorvastatin. This question tests your knowledge of common brand and generic drug names, which is crucial for safety in a pharmacy setting. Lipitor is a well-known brand name for the medication atorvastatin, used primarily to lower cholesterol. Recognizing this pair helps prevent medication errors and ensures patients receive the correct drug. For instance, if a prescription calls for Lipitor, you should dispense atorvastatin. Always double-check brand generic pairs, especially for the top 200 drugs, as they are frequently prescribed. Question 2. A patient picking up their prescription for lisinopril, Prinavol, Zestrol should be advised about which common side effect? A. Weight gain. B. Dry cough. C. Constipation. D. Drowsiness. Answer B. Dry cough. This question assesses your understanding of common side effects associated with widely prescribed medications, particularly ACE inhibitors like lisinopril. The key clue is the drug class, as a persistent dry cough is a characteristic side effect of ACE inhibitors, affecting a significant number of patients. This cough is typically non-productive and can be quite bothersome, sometimes leading to discontinuation of the medication. Informing patients about this helps them understand what to expect and when to contact their prescriber. Question 3. Metformin glucophage belongs to which drug class? A. Thiazolidinedione. B. Sulfonylurea. C. Biguanide. D. DPP-4 inhibitor. Answer C. Biguanide. This question asks about the drug class of metformin, a fundamental concept for understanding how medications work. Metformin is a biguanide, and it's a first-line medication for type 2 diabetes because it helps lower blood glucose by decreasing glucose production in the liver and improving insulin sensitivity. Knowing drug classes helps you anticipate a drug's mechanism of action and potential side effects. For example, all biguanides work similarly, so understanding one helps with others in the class. Question 4. Which of the following auxiliary labels is most important to apply to a prescription for amoxicillin suspension? A. Take with food. B. May cause drowsiness. C. Shake well before each use. D. Avoid prolonged sun exposure. Answer C. Shake well before each use. This question focuses on the essential auxiliary labels for common liquid medications. Amoxicillin suspension is an antibiotic that requires thorough mixing to ensure an accurate dose and consistent drug delivery. If not shaken, the active medication can settle at the bottom, leading to underdosing in early doses and potential overdosing later on. Always prioritize labels that directly impact drug efficacy and patient safety, especially for suspensions that clearly separate upon standing. Question 5. What is the primary indication for taking omeprazole, Prilosec? A. High blood pressure. B. Depression. C. Acid reflux/GERD. D. Bacterial infection. Answer C. Acid reflux/GERD. This question tests your knowledge of the main uses for common medications, which is vital for patient counseling. Omeprazole is a proton pump inhibitor, PPI, primarily prescribed to reduce stomach acid production, making it effective for treating conditions like gastroesophageal reflux disease, GERD, heartburn, and stomach ulcers. Understanding the primary indication helps you confirm the prescription's appropriateness and provide accurate patient education. For example, if a patient asks why they are taking it, you can explain it's to reduce their heartburn. Question 6. A patient is prescribed warfarin, Coumadin. Which of the following is a critical counseling point? A. Take with a full glass of milk. B. Avoid grapefruit products. C. Maintain a consistent intake of vitamin K. D. May cause orange discoloration of urine. Answer C. Maintain a consistent intake of vitamin K. This question addresses crucial patient counseling points for high-risk medications, specifically anticoagulants like warfarin. Warfarin works by interfering with vitamin K-dependent clotting factors, so significant fluctuations in dietary vitamin K intake can directly impact its effectiveness and safety. Patients don't need to avoid vitamin K, but rather keep their intake consistent to allow for proper dose adjustment. This is essential for preventing both clotting and bleeding complications. Question 7. Which medication is commonly prescribed to treat an acute asthma attack? I. Montelukast, singular. B. Salmeterol, Ceravent. C. Fluticasone, Flovent. D. Albuterol, Proer, Ventolin. Answer D. Albuterol, Proer, Ventolin. This question assesses your knowledge of medications used for respiratory conditions, specifically distinguishing between rescue and maintenance inhalers. Albuterol is a short-acting beta agonist, SABA, that quickly opens airways, making it the go-to medication for immediate relief of asthma symptoms or an acute asthma attack. In contrast, the other options are typically used for long-term control or prevention. Always confirm a patient understands the difference between their rescue inhaler and their maintenance inhalers. Question 8. The generic drug metoprolol is available in two common forms, tartrate and succinate. What is the primary difference in their dosing? I. Tartrate is for immediate release. Succinate is for extended release. B. Tartrate is taken once daily. Succinate is taken twice daily. C. Tartrate is an eye drop. Succinate is an oral tablet. D. Tartrate is a diuretic. Succinate is a beta blocker. Answer I. Tartrate is for immediate release. Succinate is for extended release. This question tests your understanding of different formulations of the same drug, a critical detail for patient safety. Metoprolol tartrate, low pressor, is an immediate release beta blocker, typically dosed twice daily, while metoprolol succinate, Toprol XL, is an extended release beta blocker dosed once daily. Misinterpreting these forms can lead to incorrect dosing and potential harm. It's vital to recognize that different salt forms or suffixes can indicate significant differences in release profiles and dosing frequencies. Question 9. What is the generic name for Synthroid? I. Desiccated thyroid. B. Levothyroxine. C. Liothyronine. D. Methimazole. Answer B. Levothyroxine. This question tests your knowledge of a very common brand to generic name conversion for a critically important medication. Synthroid is the widely recognized brand name for levothyroxine, a synthetic thyroid hormone used to treat hypothyroidism, underactive thyroid E. Knowing this pair is essential because levothyroxine is one of the most frequently prescribed drugs in the United States. Ensure you always confirm the correct drug and dose, as even small changes can significantly impact patient health. Question 10. Gabapentin, Neurontin, is commonly prescribed for which of the following conditions, besides seizures? I. Insomnia. B. Neuropathic pain. C. High cholesterol. D. Heart failure. Answer B. Neuropathic pain. This question asks about a less obvious, but very common indication for a frequently prescribed drug. While originally approved for seizures, gabapentin is very widely used off-label to manage neuropathic pain, such as diabetic neuropathy or postherpetic neuralgia. Understanding multiple indications for a drug helps you identify potential uses and answer patient questions effectively. Always remember that drugs often have several therapeutic applications beyond their primary approved use. Question 11. Which drug class is associated with the suffix pril? I. Beta blockers. B. ACE inhibitors. C. Calcium channel blockers. D. ARBs, angiotensin receptor blockers. Answer B. ACE inhibitors. This question tests your ability to recognize drug classes by their common suffixes, a powerful tool for quickly identifying drug types. The suffix pril is characteristic of ACE inhibitors, a class of medications used to treat high blood pressure and heart failure. Examples include lisinopril, enalapril, and ramipril. Learning these common suffixes helps you categorize drugs quickly and efficiently, making it easier to remember their general uses and side effects. Question 12. Tamsulosin Flomax is primarily used to treat symptoms associated with what condition? I. Erectile dysfunction. B. Benign prostatic hyperplasia, BPH. C. Kidney stones. D. Urinary tract infections. Answer B. Benign prostatic hyperplasia, BPH. This question tests your knowledge of specific drug indications for common conditions. Tamsulosin, an alpha-1 blocker, primarily works by relaxing the muscles in the prostate and bladder neck, making it easier for men with benign prostatic hyperplasia, BPH, to urinate. Recognizing this primary use helps you understand the patient's condition and provide appropriate counseling. For example, you can advise patients that it helps improve urine flow and reduces urgency. Question 13. Which of the following drugs is a common selective serotonin reuptake inhibitor, SSRI, used to treat depression? I. Alprazolam, Xanax. B. Bupropion, Wellbutrin. C. Sertraline, Zoloft. D. Trazodone, Deserel. Answer C. Sertraline, Zoloft. This question tests your ability to identify common medications within a specific drug class, which is fundamental for understanding psychiatric medications. Sertraline's Zoloft is a widely prescribed selective serotonin reuptake inhibitor, SSRI, used for depression, anxiety, and other mood disorders. Recognizing SSRIs helps you understand their mechanism of action and common side effects, such as gastrointestinal upset or sexual dysfunction. Always verify the drug class to ensure proper dispensing and patient education. Question 14. What is the most important counseling point for a patient starting on a new prescription for a corticosteroid, such as prednisone? I. Take on an empty stomach. B. Stop immediately if symptoms improve. C. Take with food or milk to prevent stomach upset. D. It can be crushed and mixed with juice. Answer C. Take with food or milk to prevent stomach upset. This question highlights a crucial counseling point for corticosteroids, which are often associated with gastrointestinal irritation. Prednisone, like many corticosteroids, can cause stomach upset, nausea, or indigestion. Taking it with food or milk helps to buffer the stomach lining and minimize these uncomfortable side effects. It's also important for patients to understand that corticosteroids should not be stopped abruptly due to the risk of adrenal insufficiency. Question 15. The abbreviation QID on a prescription indicates that the medication should be taken. I. Once daily. B. Twice daily. C. 3 times daily. D. 4 times daily. Answer D. 4 times daily. This question tests your knowledge of common prescription abbreviations, which are vital for accurate dispensing and patient safety. QID is a standard medical abbreviation derived from the Latin quater indi, meaning 4 times a day. Misinterpreting abbreviations can lead to serious medication errors, so it's critical to know them accurately. Always clarify any ambiguous abbreviations with the prescriber to ensure patient safety. Question 16. What is the generic name for Xarelto? I. Dabigatran. B. Rivaroxaban. C. Apixaban. D. Adoxaban. Answer B. Rivaroxaban. This question tests your knowledge of common brand and generic drug names, specifically for novel oral anticoagulants. Xarelto is the well-known brand name for rivaroxaban, an anticoagulant used to prevent and treat blood clots. Knowing this brand generic pair is important because these medications are high risk and require careful dispensing. Make sure to differentiate between similar-sounding NOACs to prevent medication errors. Question 17. Which of the following medications requires a do not chew, crush, or split auxiliary label due to its extended release formulation? I. Amoxicillin 250 mg capsule. B. Ibuprofen 200 mg tablet. C. Metoprolol succinate ER 50 mg tablet. D. Acetaminophen 500 mg tablet. Answer C. Metoprolol succinate ER 50 mg tablet. This question focuses on critical auxiliary labels for specific drug formulations, essential for patient safety and drug efficacy. Metoprolol succinate, or extended release, is designed to release medication slowly over time, and chewing, crushing, or splitting it would destroy this mechanism, leading to rapid drug release and potential overdose or reduced effectiveness. Always apply the do not chew, crush, or split label to any extended release, sustained release, or enteric-coated medications. Question 18. What is the primary drug class of ciprofloxacin, Cipro? I. Penicillin antibiotic. B. Macrolide antibiotic. C. Fluoroquinolone antibiotic. D. Cephalosporin antibiotic. Answer C. Fluoroquinolone antibiotic. This question assesses your knowledge of antibiotic drug classes, which is important for understanding their spectrum of activity and potential side effects. Ciprofloxacin belongs to the fluoroquinolone class of antibiotics, known for their broad-spectrum activity against various bacterial infections. Recognizing this class helps associate it with important counseling points, such as avoiding antacids and potential risks like tendon rupture. Categorizing antibiotics by class helps organize your knowledge of their uses and precautions. Question 19. Patients taking spironolactone aldactone should be monitored for which electrolyte imbalance? I. Hyponatremia, low sodium. B. Hypokalemia, low potassium. C. Hyperkalemia, high potassium. D. Hypocalcemia, low calcium. Answer C. Hyperkalemia, high potassium. This question tests your understanding of medication-induced electrolyte imbalances, which is a critical aspect of patient safety. Spironolactone is a potassium-sparing diuretic, meaning it helps the body excrete excess fluid while retaining potassium. Therefore, patients taking spironolactone are at an increased risk of developing hyperkalemia, high potassium levels. It's important to monitor potassium levels regularly and advise patients to avoid potassium supplements or high potassium foods unless directed by their doctor. Question 20. Which of the following medications is a commonly prescribed HMG-CoA reductase inhibitor, also known as a statin? I. Losartan, Cozar. B. Amlodipine, Norvasc. C. Atorvastatin, Lipitor. D. Furosemide, Lasix. Answer C. Atorvastatin, Lipitor. This question asks you to identify a statin, a very common class of drugs for cholesterol management, by both its generic and brand name. Atorvastatin, Lipitor, is a potent HMG-CoA reductase inhibitor, which effectively lowers cholesterol levels in the blood. Recognizing statins is essential for understanding their primary use and common side effects, such as muscle pain. Remember that most drugs ending in statin belong to this important class. Question 21. What is the generic name for Celebrex? I. Meloxicam. B. Naproxen. C. Ibuprofen. D. Celecoxib. Answer D. Celecoxib. This question tests your knowledge of common brand and generic drug names, specifically for an NSAID that has some unique characteristics. Celebrex is the brand name for celecoxib, which is a COX-2 selective nonsteroidal anti-inflammatory drug, NSAID. Knowing this pair is important because celecoxib is often prescribed for pain and inflammation, particularly in patients who may have a higher risk of stomach upset with traditional NSAIDs. Make sure to link brand names with their corresponding generic counterparts. Question 22. Which drug class is characterized by the suffix sartan? I. ACE inhibitors. B. Beta blockers. C. Angiotensin receptor blockers, ARBs. D. Calcium channel blockers. Answer C. Angiotensin receptor blockers, ARBs. This question tests your ability to recognize drug classes by their common suffixes, a fundamental skill for pharmacy technicians. The suffix sartan identifies medications as angiotensin receptor blockers, ARBs, which are used to treat high blood pressure and heart failure. Examples include losartan, valsartan, and irbesartan. Learning these common patterns helps you quickly identify a drug's class and predict its general mechanism of action and common uses. Question 23. A common side effect of opioid pain medications, such as hydrocodone/acetaminophen, Norco, Vicodin, that patients should be counseled on is I. Diarrhea. B. Insomnia. C. Constipation. D. Hyperactivity. Answer C. Constipation. This question focuses on a very common and often bothersome side effect of opioid analgesics, which is crucial for patient counseling. Opioid medications like hydrocodone/acetaminophen slow down gut motility, leading to significant constipation in many patients. It's essential to counsel patients on strategies to manage this, such as increasing fiber and fluid intake or recommending over-the-counter laxatives. Addressing this proactively can greatly improve patient comfort and adherence. Question 24. What is the appropriate storage condition for most insulin products once opened? I. Room temperature for 28 days. B. Refrigerated at all times. C. Frozen until ready to use. D. Kept in direct sunlight. Answer I. Room temperature for 28 days. This question tests your knowledge of proper drug storage, which is vital for maintaining medication efficacy, especially for sensitive products like insulin. Once an insulin vial or pen is opened, it is typically stable at room temperature for up to 28 days or other manufacturer-specified duration to make it more comfortable for patients to inject. However, unopened insulin should always be stored in the refrigerator. Always check the specific product's package insert for precise storage guidelines. Question 25. Which of the following medications is a common proton pump inhibitor, PPI? I. Famotidine, Pepsi-D. B. Ranitidine, Xantac. C. Esomeprazole, Nexium. D. Cimetidine, Tagamet. Answer C. Esomeprazole, Nexium. This question requires you to distinguish between different classes of acid-reducing medications. Esomeprazole, Nexium, is a proton pump inhibitor, PPI, which works by irreversibly blocking the proton pump in stomach cells to reduce acid production. The other options are H2 blockers, which have a different mechanism of action and are generally less potent. Recognizing drugs by their specific class, and not just their general use, is crucial for understanding their efficacy and side effects. Question 26. What is the most important counseling point for a patient starting on a prescription for azithromycin, Z-Pak? I. Take with grapefruit juice. B. Take until symptoms resolve, then stop. C. Finish all medication even if you feel better. D. May cause significant weight gain. Answer C. Finish all medication even if you feel better. This question addresses a critical counseling point for all antibiotic therapies, essential for preventing antibiotic resistance and ensuring full recovery. Azithromycin, like most antibiotics, must be completed as prescribed, even if the patient feels better, to eradicate the infection fully and prevent the development of drug-resistant bacteria. Stopping early can lead to a relapse of the infection or allow stronger bacteria to grow. Always emphasize the importance of completing the entire course of antibiotics. Question 27. What is the generic name for Plavix? I. Aspirin. B. Warfarin. C. Clopidogrel. D. Ticagrelor. Answer C. Clopidogrel. This question tests your knowledge of common brand and generic drug names, specifically for an important antiplatelet medication. Plavix is the well-known brand name for clopidogrel, an antiplatelet drug used to prevent blood clots in patients with heart disease or after a stroke. Knowing this brand-generic pair is crucial for safe dispensing and patient education, as clopidogrel is a high-risk medication. Be precise when identifying medications used for blood clot prevention. Question 28. Which of the following is an expected side effect of taking a loop diuretic like furosemide, Lasix? I. Increased blood pressure. B. Fluid retention. C. Frequent urination. D. Constipation. Answer C. Frequent urination. This question assesses your understanding of the expected effects of a common diuretic medication. Furosemide, Lasix, is a potent loop diuretic that works by removing excess fluid from the body, primarily by increasing urine production. Therefore, frequent urination is a primary and expected effect of taking this medication. Patients should be counseled on this effect and advised to take it earlier in the day to avoid nighttime awakenings. Question 29. What is the generic name for Cymbalta? I. Fluoxetine. B. Paroxetine. C. Venlafaxine. D. Duloxetine. Answer D. Duloxetine. This question tests your knowledge of common brand and generic drug names, specifically for a popular antidepressant. Cymbalta is the brand name for duloxetine, a serotonin norepinephrine reuptake inhibitor, SNRI, used to treat depression, anxiety, and neuropathic pain. It's important to differentiate between various antidepressants, as many have similar-sounding names but belong to different drug classes. Accurately knowing brand-generic pairs for psychiatric medications is critical for patient safety. Question 30. A patient on atorvastatin Lipitor should be advised to report which serious side effect immediately to their prescriber? I. Mild headache. B. Muscle pain or weakness. C. Occasional heartburn. D. Drowsiness. Answer B. Muscle pain or weakness. This question focuses on recognizing a potentially serious and dose-limiting side effect of statin medications. While mild side effects can occur, unexplained muscle pain, tenderness, or weakness, myalgia, can be a sign of a more severe condition like rhabdomyolysis, which can lead to kidney damage. Therefore, patients taking atorvastatin should be counseled to report muscle issues promptly. Always prioritize counseling on severe side effects that require immediate medical attention.